Let me tell you about two women. Both are 63 years old. Both have T-scores around -2.8. Both sat in a doctor's office and heard the same words. You have osteoporosis. Here is a prescription for Fosamax. One woman filled the prescription that afternoon. She took it exactly as directed. Her next DEXA was stable. No further loss, no fractures. She never looked back. The second woman went home, opened her laptop, and started researching. She spent weeks reading about nutrition, exercise, bone remodeling, pH balance. She found a nutritional protocol, 14 steps, and committed to it fully. Her next DEXA showed measurable improvement. Her T-score moved into the osteopenia range. Which one made the right choice? They both did, because there is no single right answer for osteoporosis. There is only the right answer for you. Today, I am going to walk you through both paths, honestly, without an agenda, so you can have the conversation that actually matters, the one with your doctor about your bones, your risk, and your next step. As a gentle reminder, Option 1, the medication path. Here is what bisphosphonates like Fosamax, Actinol, and Reclast actually do. They slow down your osteoclasts, the cells that break down old bone. By slowing bone breakdown, they give your osteoblasts, the builders, a chance to catch up. The clinical data is substantial. These medications reduce vertebral fracture risk by 40 to 70% in women with osteoporosis. That is not a small number. That is decades of research across thousands of patients. These medications save people from fractures. They keep people out of nursing homes. They preserve independence. Now, let me be honest about the other side, because informed consent means knowing the full picture. The most common side effects are gastrointestinal, nausea, heartburn, stomach pain. These affect roughly 10 to 20% of people and often improve over time. Then there are the rare but serious risks you may have read about. Osteonecrosis of the jaw, that is jawbone deterioration, occurs in approximately 1 in 10,000 to 1 in 100,000 patients taking oral bisphosphonates. The risk is higher with high-dose intravenous forms used for cancer, not standard osteoporosis treatment. Atypical femoral fractures, unusual breaks in the thigh bone, occur in roughly 1 to 5 per 10,000 patients after 3 to 5 years of use. These are real numbers. They matter, but they must be weighed against the fracture risk of untreated osteoporosis, which is dramatically higher. For context, a woman with a T-score below -2.5 has roughly a 40% lifetime risk of a major osteoporotic fracture. That is not a fear tactic. That is the epidemiological data. The question is not, does this medication have risks? Every medication has risks, including Tylenol. The question is, do the benefits outweigh the risks for your specific situation? And that is a question only you and your doctor can answer together. Option 2, the natural and lifestyle path. This approach focuses on what you can do through nutrition, targeted exercise, and daily habits to support your bone remodeling cycle from the inside. The research here is growing, not as large as the medication trials, but significant. The LIFTMOR trial. That stands for Lifting Intervention for Training Muscle and Osteoporosis Rehabilitation, showed that high-intensity resistance training improved bone mineral density in postmenopausal women with low bone mass. No medication. just consistent, supervised, progressive weight training. Nutritional intervention studies have shown that increasing protein intake, specifically to at least 1.2 grams per kilogram of body weight, supports bone density when combined with adequate calcium, vitamin D, and vitamin K2. The advantages of the natural path are real. No drug side effects, whole body benefits beyond just your bones, and a sense of agency. You are actively doing something every day, but the limitations are equally real. This path requires consistency. It takes longer to show measurable results, often 12 to 18 months to see DEXA changes. And for women with very severe osteoporosis or a history of fractures, lifestyle alone may not be sufficient to reduce fracture risk quickly enough. The natural path is not a rejection of science. It is an application of it through your daily plate, your weekly movement, and your long-term commitment. Option 3, the combined path. This is what most of the success stories we covered in the last video actually chose. They did not pick one path and reject the other. They picked both. Medication to slow the rapid bone loss and reduce immediate fracture risk. Buying time. Lifestyle to support the rebuilding process and create long-term bone health that does not depend entirely on a prescription. Think of it this way. If your bone density is declining rapidly, medication can act as a brake, slowing the loss while you build the nutritional and exercise habits that will sustain you for decades. After a period of stability, some women work with their doctors to reevaluate. Can we reduce the dose, take a drug holiday, or transition to lifestyle-only maintenance? This is not an all-or-nothing decision. It is a conversation that evolves as your bone health evolves. So, how do you walk into your next appointment and actually have this conversation? Not the 5-minute prescription handoff, but a real, informed discussion about your path. Here are the 4 questions to bring with you. Write them down. Put them in your phone. Take them to your doctor. Question 1. How severe is my bone loss and how fast is it progressing? A single T-score is a snapshot. 2 DEXA scans spaced a year or 2 apart give you the trend, and the trend matters more than the number. Question 2. What is my actual fracture risk, not just my T-score? Your doctor can calculate something called FRAX, the Fracture Risk Assessment Tool, which factors in your age, your bone density, your family history, and your personal history to estimate your 10-year fracture probability. Question 3. What lifestyle changes am I willing and able to make consistently? Be honest with yourself. Are you ready to change your diet, commit to weight-bearing exercise 3 times a week, take targeted supplements daily? If yes, that changes the conversation. If not, that also changes the conversation. Question 4. Can we try a lifestyle-first approach for 6 to 12 months and retest? Or is my fracture risk too high to wait? This is the question that transforms a passive patient into an active partner in your own bone health. Some doctors will say yes, some will say no, and if they say no, they should be able to explain exactly why based on your numbers, not a generic protocol. These 4 questions will change your next appointment from a prescription handoff into a real conversation. If you are leaning toward the natural path, either alone or alongside medication, the next video walks you through the bone density solution in full, module by module, step by step, what is inside the program, how it works, and who it is designed for, so you can decide if it is the right next step for your bone health journey. In my very next video, I'm walking you through the bone density solution, module by module, step by step. Subscribe and hit the bell so you don't miss it. You are not your T-score, and information is where agency starts. This is the conversation your doctor did not have time for.